So for our project, we took a look into Mayo's emergency department engineering team and how they're looking into implementing engineering into the emergency room.
Hi, how can I help you today?
Hi, I've been having a cold. My sinuses are really congested and they really hurt, and I've had a cough for like a week.
Okay, can you tell me your first and last name?
Mary Johnson?
Okay, we'll send in a nurse soon to see if you can wait in the waiting room for now.
Okay, thank you.
They told me to come here. I don't feel like I need to be here. I just thought about taking my pills like one time. I'm just really stressed out with my job and I don't even know. I'm supposed to come here.
Okay, can you tell me your first and last name?
Amy Anderson.
Okay, we'll send someone in shortly. Can you have a seat in the waiting room?
Fine.
Hi, how can I help you today?
Hi, my name is Megan Smith. I've been having some chest pain and trouble breathing for the past hour.
Okay, we'll make sure someone sees you shortly, and the waiting room is right over there.
Okay.
Thank you. Alright, so who do we have here? So we have Mrs. Johnson. She came in with some sort of a cough. And then Mrs. Anderson, she came in, she seems a little bit crazy. And Mrs. Smith was the last one to come in. She claims of some kind of chest pain.
Okay, sure.
And they came in this order.
Okay, so then let's go with Miss Johnson, the first patient.
Okay. So Mrs. Johnson, the doctor will see you now.
Okay, thank
So
you.
we'll just go back, get some vital signs, and then the doctor will see you.
Okay, thanks. Excuse me, my chest pain is getting really, really bad. I think like something is not right. Like I need to see somebody like now.
The doctors are very busy.
Wait a minute. I was here before you and I've been waiting here for like 2 hours. I think this is just ridiculous. I'm done. I'm just leaving.
No, ma'am, we really insist you stay. The doctors are very busy, but they should be with you any minute.
The emergency redesign features call for an increase in space, an increase in beds from 51 to 74, 4 resuscitation suites that are going to be offered to new sicker patients that have a specialized care system, new intake area that allows for more rapid initial evaluation of patients and treatment for those who don't need a room in the emergency department. And then universal room design will provide greater efficiency and capacity for monitoring and treating patients. Space increases for dedicated child and teen-friendly treatment areas have been implemented. And then lastly, doors and walls that are going to be used to separate rooms rather than curtains. This will help protect privacy for patients and families. So this is the first step in our archetype, and it calls for short wait times to improve patient transfer and triage to different units. This helps lead to ED success. So the center of our archetype bubbles include the patient-centered care. First of all, this will lead to better care flow. Second, this will lead to better triage, which will help lead to shorter wait times for the patients. This will be done by attaching an engineering laboratory to the emergency department. The engineering lab will utilize tracking and tracing bracelets on equipment. With the clinical engineering laboratory's data, the team will monitor implementation of staging model, study the downstream impact of the patient flow throughout the emergency department, and offer strategies for continuous improvement. The engineering department's success will help open rooms and properly triage patients to create room for new transfers from the intensive care unit. This will reduce wait times for patients and improve quality in the CCUs. Previously noted, the inner ring will stay the same here. To improve, CCUs will implement proper staffing models. With proper nurse-patient ratios, direct care with focus can be implemented. This will lead to more rapid discharge and transfer times. This is the final archetype, and this just goes to show that it's all related together, and success in one will lead to success in the other, or failure in one will lead to failure in another.
cold for a few days. It's just getting worse.
Okay. Perfect. Can I get your name?
Mrs. Johnson.
Okay.
Joanna.
All right. All right, Joanna, I have you all checked in. I'm just going to have you wear this face mask since you do have flu symptoms. I'll just have you sit in the waiting room right over here, and we'll get you back as soon as we can.
Hi,
Hi, sir. What brings you in today?
my name is Nick Anderson. I guess I don't know exactly why I'm here. I just lost my job and I've been thinking about taking all my pills to end it all.
Okay. Yeah, well, I'm going to get you seen right away.
Hello, this is Stephanie.
Hi, Steph. I have a patient here. If you could come see Mr. Johnson.
Sure, I'll be right there.
All right, bye. Mr. Johnson?
Hi, come on back with me. My name's Stephanie. I'm a nurse here in the ER. Gotta get you
Sure.
started, okay? Why don't you go ahead and take a seat? And why don't you tell me what's going on?
Well, recently I lost my job and things haven't been going right for me.
Hello, what brings you in today?
I'm having really bad chest pain.
Okay, can I get your name?
Jane Smith.
All right, Jane, we're gonna get you seen right away. Let me get the nurse for you. Adrian,
Hi, Mrs. Smith. Why don't you come check with me?
I'll page the doctor for you.
Thank you. You can go ahead and have a seat here. Can you describe your chest pain for me?
It just hurts really bad.
Is it a sharp pain, a dull pain?
It's sharp
Sharp.
and aching.
Can you feel it anywhere else? Is it radiating?
It just hurts everywhere.
Everywhere? Okay.
My
On a-
chest and my back.
on your back. On a scale of 1 to 10, how would you describe it?
It's probably a 7.
A 7. What about your shortness of breath? How would you describe that, 1 to 10?
I feel like I'm having trouble,
Trouble
but
breathing?
it's
Okay.
not too bad right now.
Okay, I'm going to take a quick listen to you, and then we will get the doctor in here to see you. There's the doctor now.
All right, what's going on
This
here?
is Miss Smith. She is 25 years old and she presented with symptoms of an MI. She has chest pain, 6 out of 10. Having trouble breathing. I recommend that we start sublingual nitrogen right away, get her in the cath lab for an exploratory surgery, and just take it from there. We'll get a 12 lead too.
I agree.
Okay, sounds good.
All right, Miss Johnson, sorry about your 30-minute wait. We do have a room for you now. Let's get you seen. Just follow me. All right, Adrian, Shelby.
Hi, Miss Johnson. You
Get
can
me
go
a
ahead
sec.
and take a seat. I'll come around to your side. Oh, bless you.
Ooh.
Can you describe what kind of symptoms you're having?
I haven't been able to eat. I've had a runny nose, a headache.
Are you having any trouble breathing or chest pain?
No.
No?
Mm-mm.
Okay. Let me just take a quick assessment and then we'll get the doctor in here to see you.
Okay, so let's talk about the triage that we just went over in the emergency department. Let's talk about Mrs. Smith and the chest pain.
Mrs. Smith, 20-year-old female, was admitted with symptoms of a STEMI. She has been sent to the cardiac cath lab, and depending on the doctor's recommendation, will most likely go to surgery or back to the cardiac care unit for observation.
Okay, sounds good. I agree with that. All right, then let's go with Mr. Anderson with the suicidal ideations.
Mr. Anderson is currently in the psych ER department. He is being observed for suicide ideations. He has a plan, and my recommendations are to keep him on a 72-hour hold in the psych unit.
Okay, good recommendations. I will write you an order, and we will get him transferred over to the psych department.
Great.
And then last, let's do Mrs. Johnson with the flu-like symptoms.
Mrs. Johnson's flu test came back positive, so she, it depends what you'd like to do to her, if you want to give her fluids and have her stay overnight, or if you want to discharge her with a prescription for Tamiflu.
Okay.
Whatever you think is the best route with her. She's not having any chest pain or shortness of breath, like stereotypical flu symptoms.
Okay, because the situation is not very dire, I will discharge her with a Tamiflu prescription and have her follow up with her primary care provider.
Okay, yeah, that sounds good.
Go.
1 and 2 and push happy. 1 and 2 and push happy.